Waking up with a dry mouth can feel small, but it can affect your whole day. Your throat may feel scratchy, your tongue may feel rough, and even your breath can seem worse. The key question is simple: why did your mouth dry out while you slept? Most of the time, it comes down to airflow, saliva production, or what your body was doing overnight. Sometimes it's a harmless habit, like sleeping with your mouth open. Other times it's a clue, like nasal blockage or sleep-related breathing issues. Dry mouth also matters because saliva protects teeth and gums. When saliva drops, bacteria get an easier job. That can raise the risk of cavities and gum irritation over time. The good news is you can usually narrow the cause with a few observations. We'll walk through the most common reasons, what they typically feel like, and what patterns to look for. By the end, you'll have a clear checklist to discuss with a clinician if needed.
Moving to slide 2. Let's start with the basics. Saliva is not just spit. It's a protective fluid that coats tissues, balances acids, and helps control microbes. While you sleep, saliva production naturally drops. That's normal. The problem happens when something pushes it from lower to too low. At that point, your mouth can feel sticky, your lips may feel dry, and swallowing may feel oddly effortful. Saliva also buffers acid, so when it's missing, your teeth spend more time exposed to a harsher environment. Another detail people miss is that saliva flow is tied to your nervous system and hydration status. Stress, certain breathing patterns, and even room conditions can shift the balance. So dry mouth is often a combination issue, not a single cause. Think of it like a 3-part equation: saliva supply, air exposure, and how long it lasts. If you wake up dry only occasionally, it may be situational. If it's frequent, it's worth mapping the pattern. Moving to slide 3. One of the most common causes is simply mouth breathing. If your lips are open for hours, airflow evaporates moisture from your tongue and cheeks. Many people don't realize they do it until they notice drooling, a dry throat, or waking up thirsty. Mouth breathing often starts because the nose isn't moving air well. It can also be a learned sleep posture, especially if you sleep on your back. Another clue is waking with a dry mouth, plus a hoarse voice that improves after drinking water. If your partner hears snoring, that can fit the same pattern, because snoring often comes with turbulent airflow and an open mouth. Mouth breathing also changes the mouth's environment, making it easier for odor-causing bacteria to build up overnight. The practical takeaway is to ask, was my nose clear when I went to bed? And do I wake up with a dry throat or just a dry mouth? Those details help separate airflow problems from saliva problems. Moving to slide 4. If mouth breathing is the effect, nasal obstruction is often the cause. A stuffy nose forces you to switch to your mouth, especially during deeper sleep. Common reasons include allergies, chronic congestion, a deviated septum, or nasal polyps. You don't need to diagnose which one it is, just notice the pattern. If dry mouth is worse during certain seasons or after dust exposure, allergies become more likely. If one side of your nose is almost always tighter, structural issues move up the list. Another clue is waking up with pressure around the nose or frequent postnasal drip. Even mild nasal blockage can matter because sleep breathing is less active than daytime breathing. Your body tends to take the path of least resistance. So if the nose is narrow, the mouth opens. If this is your main pattern, it's useful to track nasal symptoms alongside dry mouth for a week or 2. That timeline can make a clinical conversation much clearer. Moving to slide 5. Sometimes dry mouth is a sign your sleep breathing is disrupted, not just a blocked nose. Obstructive sleep apnea and related sleep-disordered breathing can lead to repeated mouth opening, snoring, and very dry mornings. You might also notice waking up unrefreshed, morning headaches, or needing to urinate at night. Not everyone with dry mouth has apnea, but the combination of loud snoring, gasping, or witnessed pauses in breathing is a stronger signal. The reason dryness shows up is mechanical: more mouth breathing, more airflow, and often longer time spent with the mouth open. People also tend to sleep with a dry throat and thick saliva when breathing is strained. If you suspect this pattern, it's worth discussing screening with a clinician because sleep-related breathing issues affect more than comfort.
They can influence blood pressure, mood, and daytime focus. The main point here is not to self-diagnose. It's to recognize when dry mouth is part of a bigger sleep picture.
Moving to slide 6. Another big category is dehydration and fluid balance.
If you go to bed already slightly dehydrated, you start the night with less reserve. Then saliva drops naturally during sleep, and you wake up feeling dry. This can happen after heavy sweating, long flights, heated indoor air, or simply not drinking enough water earlier in the day. It can also happen if you eat a very salty dinner, because salt shifts fluid balance and can increase thirst.
A useful clue is whether you also wake up with dry eyes, darker urine in the morning,
or a strong urge to drink right away. That said, thirst can also be driven by mouth breathing, so you're looking for a cluster of signs. Another overlooked factor is diuretics like caffeine late in the day for some people, which can increase nighttime urination and reduce overall hydration. The goal is not to chug water at bedtime. It's to notice whether dry mouth tracks with your daytime hydration habits and evening meals.
Moving to slide 7.
Your bedroom environment can quietly dry you out.
Low humidity pulls moisture from surfaces, including the tissues in your mouth and throat.
Heating systems in winter and strong air conditioning in summer can both lower indoor humidity.
Fans can add another layer by increasing airflow across your face while you sleep.
The result can feel like you slept in a dry box, dry lips, dry throat, and a need to sip water.
A simple clue is whether symptoms improve when you sleep somewhere else, like a hotel or a different room.
Another clue is waking with staticky hair, dry skin, or a scratchy nose, which points to dry air rather than a medical cause. Of course, environment can combine with mouth breathing and make it worse. If your nose is slightly blocked and the air is very dry, you get a double hit. So it's worth treating your room like part of the experiment. Notice temperature, airflow direction, and whether you wake up drier when the heat or AC runs all night.
Moving to slide 8. Medications are a very common reason for persistent dry mouth.
Many drug classes can reduce saliva as a side effect, including certain antidepressants, antihistamines, blood pressure medications, and medications used for bladder symptoms. The mechanism varies, but a lot of them affect the nervous system signals that tell salivary glands to produce fluid. The pattern is often consistent.
Dry mouth most nights, not just after a salty meal or a bad allergy day.
You might also notice dry mouth during the day, needing water to swallow dry foods, or a sticky feeling that doesn't fully go away. This is one of those areas where the right move is documentation, not guesswork. If you suspect a medication link, note the timing, when the dryness started, and what changed around that time. Bring that list to a pharmacist or clinician. There may be options like dose timing adjustments, alternative medications, or supportive strategies. The key is to never stop or change prescribed medication on your own, based on dryness alone.
Moving to slide 9.
Dry mouth can also be tied to stress and your nervous system. When you're stressed, your body shifts toward fight or flight, and saliva can drop. Some people also clench their jaw or grind their teeth at night, which can make the mouth feel tense and dry in the morning. You might wake with sore jaw muscles, a tight temple area, or tooth sensitivity. Another pathway is reflux.
Acid irritation in the throat can trigger mouth breathing, throat clearing, and a dry, raw feeling on waking.
Not everyone with reflux feels classic heartburn, so the clue may be a sour taste, frequent burping, or a chronic cough. The important thing is that these are pattern-based clues, not definitive diagnoses. Stress, clenching, and reflux can overlap, especially during demanding periods. If your dry mouth comes with jaw soreness or a burning throat, that's a different story than my nose was stuffed. It points you toward a different conversation with a dental professional or clinician. Moving to slide 10. There are also medical conditions that can make dry mouth more likely. Diabetes can be associated with increased urination and dehydration, which can show up as thirst and dry mouth, especially in the morning. Autoimmune conditions like Sjogren's syndrome can directly reduce saliva and often come with dry eyes. Thyroid issues and certain neurological conditions can also influence saliva production in some people. The point isn't to alarm you. It's to know when dry mouth is persistent, significant, and paired with other symptoms. Red flags include difficulty swallowing, mouth sores that don't heal, frequent cavities despite good hygiene, or a dry mouth that is severe every night. Another clue is needing water to speak for long periods, or waking repeatedly to sip water. If you recognize those patterns, it's reasonable to ask for an evaluation rather than just trying random home fixes. Dry mouth is a symptom with many causes, and sometimes the cause is systemic, not local to the mouth or nose. Moving to slide 11. Dry mouth isn't just uncomfortable, it changes your oral ecosystem. Saliva helps wash away food particles and neutralize acids created by bacteria. When saliva is low, plaque can build faster, and the mouth can become more acidic for longer. That's why people with chronic dry mouth often report more cavities, especially near the gum line, and more gum irritation. You might also notice a coated tongue, a burning sensation, or cracked lips. Bad breath can become more noticeable because bacteria thrive when the mouth is dry. Another issue is sleep disruption. If you wake up to drink water, you fragment your sleep, which can make you feel tired even if you were in bed long enough. So it's worth taking dry mouth seriously, even if it seems minor. The goal is to protect teeth and improve sleep quality by identifying the driver. If you only focus on masking the symptom, you might miss the underlying pattern. Think prevention, less dryness, fewer awakenings, and a healthier mouth environment. Moving to slide 12. Here's a simple way to narrow it down. Separate airflow dryness from low saliva dryness. Airflow dryness usually comes with a dry throat, snoring, and a sense that your mouth was open. Low saliva dryness often feels sticky and thick, and it may also show up during the day. Next, look for triggers. Is it worse when your nose is congested, when the room is hot, or after a salty dinner? Then check timing. Did it start after a new medication, a new supplement, or a change in your routine? Also notice frequency. Once a week suggests environment or habits. Most nights suggests a more stable driver, like medication, chronic nasal blockage, or a medical condition. Finally, note what helps. If nasal breathing improves it, that points one way. If sipping water helps only briefly, that can point another way. This kind of tracking turns a vague complaint into useful information, and it helps you avoid chasing the wrong fix. Moving to slide 13. If you want practical, low-risk ways to reduce dry mouth, start with the obvious drivers. If your room is dry, improving humidity and reducing direct airflow can make a noticeable difference. If congestion is common, addressing the cause of nasal blockage with a clinician can reduce mouth breathing. For hydration, aim to be well hydrated earlier in the day, and be mindful of very salty evening meals. For oral comfort, some people find sugar-free gum or lozenges during the day can stimulate saliva, and at night a simple sip of water can help without overdoing it. Oral hygiene matters more when saliva is low, because saliva normally does some of that protective work for you. If you wear a dental appliance, make sure it fits well and is cleaned properly, since irritation can worsen dryness sensations. And if you suspect medication effects, the safest step is to bring a list to your pharmacist or clinician and ask about dry mouth as a side effect. The goal is to match the strategy to the cause, not just treat the symptom blindly. Moving to slide 14. Finally, let's talk about when to get help sooner rather than later. If dry mouth is severe most nights, if you're getting frequent new cavities, or if swallowing feels difficult, it's worth discussing with a clinician or dentist. If dry mouth comes with loud snoring, gasping, or daytime sleepiness, ask about sleep-disordered breathing screening. If you also have dry eyes, joint pain, or unexplained fatigue, mention that too, because it can help guide the evaluation. Bring your notes. When it happens, what you ate, nasal symptoms, medications, and whether you wake to drink water. That kind of detail saves time and improves accuracy. To wrap up, dry mouth is usually about one of three things: too much airflow through the mouth, too little saliva, or a combination. Once you know which bucket you're in, the next steps become much clearer. One quick question for you. Do you think your dry mouth is more from mouth breathing or from feeling generally dehydrated? Share your experience in the comments. If you want more clear, practical health explanations like this, subscribe. This information is not a substitute for medical advice. Your biology is programmable. Learn the signals.